So, Lynda, I know that in consultation you had said that you sort of want to change some of the squareness of here, kind of get that high arch cheekbone that's super glamorous, ease up the pressure on the nasolabial fold, get the lips restored because you feel like they flattened out and the lipstick kind of bleeds. Create a little bit more symmetry because your lip pulls a little bit more on this side and that side, and I know that's like a big thing for you. And then we're going to do the neck and the hands and...
Okay.
Okay, excellent.
I'm ready.
So the first thing I want to do is kind of create that vector that pulls up on the corners of the mouth, the nasolabial fold, and creates the arch bone. So we're going to start with one of my favorite products, Juvederm Voluma, and we're going to start with the cheekbone. And that's really a great place to start because that really sort of sets the upper part of the face. And from there we can kind of work our way down.
Okay.
Okay, ready? You okay?
I am.
Okay, perfect. How's the pain level, Lynda?
It's about a 2.
Oh, that's great.
Maybe a 3 now.
Oh, good. Maybe a 10.
Actually.
Good. And then one of the things I like to do when I do cheekbones is kind of keep looking from different angles to pick up those little shadows that everyone has. Wow, look, this fold has already disappeared. It's just a little bit. So awesome. I'm going to have you, if you don't mind, put the ice here.
My pleasure.
And then we'll do the other side. And then I think we always talk about how important symmetry is. And so what I like to do is constantly look in different angles to make sure this side matches the other, but not just that we do the same thing on each side, we make each side match the other side by correcting any natural asymmetries that each person has. Oh, I really like that.
But I think that's what you're the best at, Tanya. Really, you've got such an eye, an artistic eye for that.
The best part is it's so instant. People can look in the mirror, and they can go home and they feel so good.
It actually hurts less if you relax.
Yeah.
It does.
All these products have numbing in them, so I think as you get more and more needles...
Is it lidocaine?
Yes, exactly. Okay, so while that's doing its thing, we had talked about getting rid of Mr. Frown. So we'll put a little bit of Botox here, if you don't mind frowning for me. There we go. Go ahead and relax. Now you're a little stronger on your left than your right, so I'm going to put a little bit more on the left and the right, just to accommodate that. You know, we've talked about your forehead being sort of tiny and not wanting to drop your eyebrows and ruining the beautiful arch you have. And you have very little, and having you move and make facial expressions, you just don't even have much in the way of wrinkles there. So we're not going to treat your forehead, and I think you have very natural lines around the eyes, and if we were to get rid of those, it would look really fake, and then your smile would look weird, and so we decided not to do that.
Correct. I'm happy with that, Tanya.
I'm going to do the lips, and I know that like the asymmetry that no one else sees but you and I is a big thing for you. So I'm going to start by correcting the asymmetry, and then we'll do the lip liner that you want so that the lipstick doesn't bleed anymore. Okay? Because your natural lips are really good size. We don't want to make them bigger because I think they will not look as classy for someone in your age group.
But you're going to do the Cupid's bow.
Oh, absolutely. Absolutely. That's part of the recontouring.
Okay.
So, but we just want it recontoured. I don't want it to be bigger and plumper because I think it will look not as nice. Open your mouth for me, please. And now this is Juvederm. And I love Juvederm for the lips because I feel like it's so malleable and it adds such a nice contour. Do you feel that we've fixed that asymmetry for you? Open your mouth a little. Close it again.
Yes. It's better.
Yeah.
It is.
Yeah. I think that asymmetry is correct. So now I'm going to do the lip liner to sort of put the lips back where they should be. So if you can open your mouth for me, please. One of the things you and I have talked about a lot is for you to come in and do some Fraxel laser treatments to thicken up the skin.
I know.
And obviously we're not going to do that today, though you could if you wanted to, because I know your face is numb, but and one of the fun things about doing your lips is they're naturally so pretty and they're in the right size. It's just a matter of getting them recontoured to where God intended them to be. If you can open your mouth for me again, please. It's amazing how a little bit of volume in the lips just brings back the hydration, and the lipstick just looks so freshened up, and the lips stop looking so dull, and those fine lines just disappear, and the lipstick stays where it wants to go.
Yay.
Good. So.
That $45 lipstick will finally...
Yeah. Okay, good. You open your mouth for me, please. Perfect. Okay, I'm going to give you the mirror. I want to make sure you're happy with what we did.
It's beautiful.
Yeah. See, your lips are not bigger at all, but they have that beautiful shape, and they look so well hydrated.
The Cupid's bow is gorgeous.
Now, I'd like to work on some of the corners of the mouth, because I feel like those really give away our age. This is what's really fun when the whole face is numbed up and someone like you is the patient, because you just kind of trust me and we can put like micro droplets here, a little bit there, and just correct everything. Wow, look at that. Nice. Gorgeous. Perfect. Let's do the other side. Beautiful.
Thank you.
Perfect.
I'm so lucky to have you in my life.
Oh, you're very kind. Excellent. Very, very nice. Okay, so the next thing I want to do is kind of fix the chin, right? Because now we've created a little bit of angle that comes this way to detract from the heaviness of the jaw here and some of the pre-jowling. So now the next thing is to elongate the face, because you have a little bit of a smaller jaw compared to that, and I've done that for myself and it really works out quite well. Put a little bit in here. You have a slight asymmetry. The right side is a little smaller, so we're correcting that as we're going, and that's so normal for people to have the bone develop differently on each side. Doing okay?
Mm-hmm.
It's very important when we do chin is to make sure we don't take a beautiful, delicate woman like you and make you look like a big man with a big, masculine, manly chin. And since you smile a lot, I get to see exactly what your chin does in action, which is kind of nice. Excellent. So let me show you this. I think it's a very gentle, soft improvement.
Mm-hmm.
And what's nice about doing the chin is that it provides like a nice ledge. So when we go into neck rejuvenation, we have this nice well-defined chin, and you already had a very well-defined jawbone. So when we try to get rid of the fat and the redundancy and the strength of this muscle that's aging the neck, having this done really helps set us up to get the neck rejuvenation done right. I think that looks really nice. What do you think?
Beautiful. I love this. I really do.
Yeah.
This makes a tremendous difference.
Yeah.
So the lips are flawless.
Perfect. Good. So I think that's a very good, very natural, subtle correction. So now let's focus on the neck. The first thing we're going to do is relax some of this muscle that's pulling down and causing the aging of the neck. This is called a Nefertiti neck lift, for like the people who are all into celebritizing things. But in general, what we have to do is, this is a platysmal band,
Right.
and we need to relax that. So I'm going to have you move your neck around so that we can really see the belly of that muscle. So I'm going to have you look that way. Perfect. That really accentuates. Let me just do serial punctures along the muscle. And if you can please tilt your head down for me. Great, tilt your head back up.
So you're actually doing the cemento.
Yeah, it's just little serial punctures along the belly of this muscle, and so each person recruits differently. Like yours goes a little further down.
And the platysma?
Yeah.
Uh-huh.
So, and you definitely recruit more on the right side. So now that I see how much more you recruit on this side, we're just going to correct for it. It almost like the muscle bifurcates here. So, and you know, and I know that earlier we did the marking for the Kybella, and we're just going to chase it down with Kybella for the little fat. Then we're all set. So all the blebs.
Whoa.
Yeah.
Okay.
For where the Botox is, and that's obviously going to take a couple weeks, like up to 2 weeks, to show its effect, right? Mm-hmm. We're going to be injecting those little dots within those white markings, and that's where the Kybella is going to go. And that is the newest treatment for getting rid of the extra fat. So this extra bit of fat here that you don't like, we're going to be treating with Kybella now.
Okay.
So Lynda, now we're going to get to do your hands.
Okay.
So we're going to be doing serial punctures in all the areas that there is skin atrophy or thinning of the skin, and you don't have as much of the dermal layer, and we're going to be substituting you for radius. Obviously, being really delicate skin, you might get bruising and a lot of swelling, which is going to go down. To blend everything in, we're going to use some arnica
Wonderful.
to just massage everything in, and then in the next few weeks everything's going to look smooth and great. Ready? So one of my tricks to minimize bruising is constantly changing needles. It's a little bit more effort and mess to clean up later, but I think it's really nice in that it's always a little sharper, so you feel less, it causes less collateral injury as it pierces through the skin. Mm-hmm. So Lynda, now that we put all these blebs in, you can see that it's not 100% smooth quite yet. So I'm going to use a little bit of arnica to massage this. And you can do this yourself at home.
Okay.
Yeah, I like arnica.
Okay, I think you gave me some.
Mm-hmm. The point is that you want to use something where it obviously like reduces the friction on the skin so that you're not hurting yourself. I like arnica because of the bruising effect.
Okay.
Perfect, look at that. How much more meat you have compared to this side. Nice, huh? Now these veins are going to go down. They're not going to stay so engorged. So let's do the other side, and then we're all set.
Okay.
You feeling okay?
I do.